Statistics show that about 1 in 3 cats develop kidney problems during their lifetime. That's why we want to give you an insight into this issue in today's Zooplus magazine. The type and cause of kidney disease can vary widely. What makes it so difficult for pet owners to recognize is that kidneys have a remarkable ability to compensate. As a result, kidney disease can often take months and even years to develop. In most cases, clear signs of the disease only appear at an advanced stage. So it's all the more important that you know what to look out for and how you can support your cat's health. It is especially important to keep an eye on older cats, as the risk of chronic disease increases with age. The first signs are often fatigue, reluctance to move, and reduced appetite. If you notice symptoms in your cat that could indicate kidney disease, you should see a vet straight away to get a diagnosis and start treatment. It's the only way to slow down disease progression and improve your cat's quality of life. First, our vet starts with a medical history consultation and a general examination. This way, the most important questions about the cat, its behavior, and current condition are clarified. Various triggers can lead to acute or chronic renal insufficiency. To give you an overview, let's take a look at the most common clinical pictures. Unfortunately, it's often not possible to know for definite what originally led to kidney damage. In cases of hereditary kidney disease, breeding faults can be to blame, among other things. Some breeds are just particularly prone. Various viruses and bacterial infections are also common triggers. Additional causes can be pre-existing diseases, tumours or hyperthyroidism. These conditions can all damage the kidneys. If too many or the wrong toxins get into the kidneys, these can overtax the organ and trigger disease. It is especially important for pet owners to know a long-term unbalanced diet that has too high a phosphorus content can also lead to kidney damage. In order to gain insights into the cause and the disease, the vet carries out a series of examination steps. After a clinical examination to determine the general condition of the cat, a specific examination of the kidney area follows. Examination of the upper abdomen, where the kidneys are located, may reveal tenderness and structural changes, such as an enlargement. These can be clearly seen from an ultrasound scan and/or X-ray examination. Further indications of a kidney-damaging disease can be found through blood and urine tests, which will also confirm whether it is an acute or chronic disease. Chronic damage can often be seen in the creatine and urea levels. When there's a kidney disorder, these metabolic waste products do not leave the body via the urine as usual and are concentrated in the blood. Markers like these help the vet to determine the stage and severity of the disease. In our case, a diagnosis is emerging. The cat is suffering from chronic renal insufficiency, fortunately with quite mild symptoms. The vet suspects congenital cysts on the kidney, also called PKD, as the cause. Cyst formation in the kidney area like this shows up on ultrasound images. The cat may now receive fluid therapy. If necessary, she'll be prescribed anti-nausea medication. The medication will only treat the symptoms and improve the cat's quality of life. It can't cure the kidney disease itself. In this case, kidney-friendly food will be necessary to support the cat's health and quality of life permanently. Our vet recommends Renal, a special food from Royal Canin Veterinary range. This complete food supports kidney function in cases of chronic renal insufficiency, among other things, through a reduced content of phosphorus and high-quality proteins. In addition, it has a high energy density to allow sufficient energy intake, even with a lower quantity of food. In terms of achieving a good fluid balance, wet food is optimal. In addition to appropriate feeding, increased water intake is a crucial factor that you should keep an eye on daily. Your cat's hydration can be improved with a few little tricks. When feeding your cat dry food, you can always add a little lukewarm water. Divide the daily food allowance into several small meals. Place different drinking stations around the cat's home. Unfortunately, chronic renal insufficiency cannot be reversed. However, by carefully following recommended measures, you can support your cat so they can enjoy a comfortable daily life with as few restrictions as possible. Zooplus wishes you and your pet all the best.